Good morning, everyone. You are all very welcome to the Sláintecare Healthy Communities Launch webinar. The panel will be delighted to receive any questions you may have, so please use the Q&A feature located at the bottom of your PC or your laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Without further ado, I would now like to hand you over to Head of Stakeholder Engagement and Communications, Feighan Fox.
Hello, thank you very much, Leo. I really appreciate that. As Leo said there, my name is Feighan Fox and I work in HSE Health and Wellbeing, and we're really excited to bring you this webinar today as part of the launch of Sláintecare Healthy Communities programme. We think we have a very varied and interesting lineup for you today, and we appreciate your attendance and hope we can keep your attention for the next hour and a half to 2 hours. As per the aim of Healthy Ireland, Sláintecare Healthy Communities programme is cross-government and multi-agency. So there are lots of stakeholders to hear from today. And as well as that, there are many different components to the overall programme. So we hope to profile some of those. And we want to be able to show people what the actual initiatives are that will be arriving into the 19 communities this year. In today's webinar, you will hear from people working in the sectors that will be delivering on Sláintecare Healthy Communities programme. And we'll hear from frontline staff and service users about how these services have already benefited people in some areas. Both the Minister for Health and the Minister for Public Health, Wellbeing and the National Drug Strategy, Feighan, launched the report yesterday at a small press conference, and we hope to hear from them later as well. First up today, we're going to have a short presentation from Tom James from the Department of Health. Tom is the head of the Health and Wellbeing programme in the Department of Health, and he's been leading on the cross-government engagement in relation to Sláintecare Healthy Communities programme. So it's appropriate that he sets the scene for us here today. Over to you, Tom.
Good morning, everybody. Sorry, I'm just having a slight problem with my sharing my screen there, but we hopefully get to that. I'm delighted to be here today to talk to you about the Sláintecare Healthy Communities programme, and I want to warmly welcome you all and thank you for your attendance. As Feighan mentioned, I am the Head of Health and Wellbeing and Healthy Ireland in the Department of Health. It's really a great pleasure to have the opportunity to join what I believe is an excellent lineup today, and I'd like to thank my colleagues in the HSE for putting it together. And the event follows on from our formal launch yesterday by Minister Donnelly and Minister Feighan. So I'm just going to try to share screen again. Hopefully this works. Okay, I can't seem to get it to go into slideshow mode, so we'll just keep going. The show must go on, as they say. So the current programme for government gives a clear intention to address cross-sectoral inequalities. It includes a range of initiatives aimed at improving health and well-being across various sectors, including education, housing, transport and health. And when we think about health inequalities, what are these? Well, these are avoidable, unfair and systematic differences between different groups of people. They involve differences in health status, access to care, quality and experience of care, behavioural risk to health, but also, and very importantly within the context of the Healthy Communities programme, the wider determinants of health. So the Sláintecare Healthy Communities programme will take a place-based approach to tackling these inequalities. We know that health is created and lived by people within the settings of their everyday life, where they learn, where they work, where they play, where they love. The social determinants of health underpin the approach taken by us in Healthy Ireland. There are a range of factors that impact upon health and well-being. These factors are not usually the direct causes of illness, but are what we'd like to call the causes of the causes. So let me tell you briefly about the approach we're taking under the Healthy Communities programme. There are 19 communities that we're very pleased to announce we're investing €13 million in 2022 to try and address some of these health inequalities through the lens of the wider determinants of health and using a whole of government approach. €10 million of this funding has been provided to the HSE for the rollout of the health initiative elements of the programme. We've worked with the HSE to identify programmes that are established and we know they already work. At the launch yesterday in the Darndale Bell Centre, it was quite inspiring to see the Northside Partnership showcase the services that they provide in partnership with the HSE. We're going to hear all about these services, as Feighan mentioned, so I'm not going to dwell too long on them. But I do believe that providing additional dedicated resources within the 19 communities in these services has the potential to make a real difference. In terms of the wider determinants of health and local engagement, we have partnered through the CCMA with the local authorities. We are funding what we are calling local development officers in each community who will be employed by the relevant local authority. A local implementation team will be set up as a subgroup of the LCDC, which is a structure existing within the local authorities. The final makeup of these local implementation teams will be decided locally and be made up of people working in the area of healthcare, education, community representatives, particularly minority groups, the local community Gardaí, NGOs, the local development company, etc. A national development officer is also being recruited, and we also have an interdepartmental officials group, and I'll tell you more about that shortly. So the 19 communities are all SICAP areas, and we've worked with the HSE Health Intelligence Unit with their expertise in the development of the Health Atlas Ireland in choosing these communities. We then worked further with the local authorities to finalise the areas. The 19 communities span 14 local authorities and include a mix of urban and rural areas. So as part of our investment in the 19 communities, we've made an additional once-off funding of 4.75 million available, which equates to up to 250,000 per community. The focus of this money, which we're calling the Community Enhancement Scheme, is to support projects that will positively impact on the health and well-being of those who live within the 19 communities. The scheme has demonstrated a collaborative approach with local authorities working together with the local communities to identify projects that support the increased use of and access to amenities in their area, and particularly to invoke an improved sense of community. We've seen some excellent applications under the scheme, including outdoor table tennis tables, upgraded walking and running trails, which are accessible for all, innovative natural play areas for children, additional outdoor furniture, bike fleets, and many, many more interesting projects. So the Healthy Ireland framework acknowledges that responsibility for addressing the wider determinants of health is shared. We are working with all relevant government departments that have policy responsibility for a lot of these determinants, like long-term unemployment, education, access to green space, drug use, consistent poverty rate, to name but a few. There is an interdepartmental group, and we have buy-in from all the relevant government departments, and our colleagues recognise the importance of working together to address the wider determinants of health. The terms of reference for the local implementation team, as I mentioned, give an indicative idea of who should be on the group, but we've set it up in such a way that it is for the local area to identify those best placed to contribute. We're also going to look at plugging into existing structures that are there to avoid any duplication. The way the programme is designed to work is that the local engagement team engage with the community and identify areas where there are gaps. We're putting the local community at the heart of the programme. Local engagement is key and is designed into the structure. The 19 local development officers will be able to bring issues to the national agenda through the National Development Officer and onwards into the interdepartmental oversight group. So what we want to do is identify things from the ground up, and particularly, as Minister Donnelly mentioned yesterday, identify what works and what doesn't. So this diagram, which will probably be difficult to see as I haven't been able to get the screen up to full view. It's in no way intended to be exhaustive, but it gives you some idea of the kind of relationships that will be built by the local development officer with our partners across the community and voluntary sector and the HSE. And this is what we need, a joined up approach to try and address these very difficult wider determinants of health. We've set up an evaluation working group, and we have members from our colleagues in the Department of Health, the HSE and the Institute of Public Health. We've commissioned the Health Research Board separately to conduct an evidence synthesis on the best practice approaches to making place-based interventions to reduce health inequalities. The evidence synthesis will both inform our approach to working with the 19 communities and the evaluation of the programme itself. The evaluation of the programme will take an outcomes focus, and as I mentioned, what we're looking for is to try and find what works and which initiatives have the greatest impact in terms of improving the overall health and well-being of the people living in these 19 communities. So finally, I'd just like to thank you all for your attention. I hope I've given you a very brief whistle-stop tour of the programme. I'm delighted that it's been launched. I'm very much looking forward to the rest of the session, and I'll hand you back to Feighan now. Thank you.
Thank you very much, Tom. It's really great to hear how this will build on the established pieces of work. One of Tom's slides there, which we'll share with you later, highlighted the variety of actors in a potential interagency collaboration around these healthy community initiatives. And it occurred to me, I was looking at the registration list. We have about 650 people on at the moment on this webinar, but when I looked at the registration list, it really highlighted the spectrum of people that have interest in or engaged in this initiative. A lot of the people listening in today and watching in are, they're going to be delivering on Sláintecare health communities in the coming months and years. So just a snapshot of the audience, just to give you an idea of who's watching on with you today. We have health promotion and improvement staff from across the country. We have nurses, nurse managers, doctors, GPs, dietitians, physios, public health specialists, psychologists, clerical officers. That's just the snapshot of the HSE staff. We have civil servants from Department of Health, Agriculture, Social Protection, local housing, rural and community development, education, and we have staff from local authorities, family resource centres, local partnership companies, TUSLA, Irish Rail, drug task forces, universities, and several third-level institutes of education, homeschool liaison staff, Mental Health Ireland, Disability, Irish Men's Sheds. That's just a little snapshot of the people that are interested and are already supporting the health and wellbeing agenda and looking to find out more about this today. So up next is our own Helen Deely. She's the Interim Assistant National Director for HSE Health and Wellbeing. And Helen has been at the forefront of the work from the HSE point of view, leading and engaging across the organisation to design something that's fit for purpose and beneficial and will bring real value to these targeted communities. So Helen, over to you.
Thanks, Fergal, and good morning, everybody. Equally delighted to be here and delighted you can attend, and looking forward to providing an update in terms of where we're at around the Sláintecare Healthy Communities programme, and equally answering any queries and questions people may have. Yesterday was a very significant day, marking the formal launch of Sláintecare Healthy Communities, and it outlines the government's commitment that we need to support individuals and families who most need it to improve their long-term health outcomes and their quality of life. An investment of 10 million in the HSE represents the most significant investment in health and well-being over the last number of years. And this investment is really to target health and well-being initiatives where they're most needed within local communities, and we in health and wellbeing are very confident that we can deliver on this. The approach and investment through Sláintecare Healthy Communities presents us with an opportunity as service providers to do things differently. We're all aware that the focus of healthy communities is really on reducing health inequalities. Each of us is familiar with the evidence around large inequalities and how they affect our life expectancy over time. And our health is affected by all aspects of our life, our income, our housing, our education, the physical environment in which we live, and the opportunities that we can avail of. And the most important thing, I suppose, about this is that each of these factors will influence our ability as individuals to cope with the normal stresses of life and our ability to make healthier lifestyle choices. We also know that addressing these health inequalities is not something that the HSE or health services can do on their own, and it requires a coordinated response from all statutory, community, and voluntary organisations. We are delighted that this commitment is happening through healthy communities. Health and Wellbeing in the HSE have a strong history of collaborative working. We work with local authorities, the LCDCs, SIPCs. We work with a number of community and voluntary organisations. We work with local development companies and other key partners such as family resource centres and TUSLA. The joint approach to this multi-agency working is happening at a local level. and healthy communities will enable us to build on this approach. But none of this work will be possible without our community partners. Our commitment is to deliver a number of interventions in partnership with local community organisations within the communities where people live. This approach is something that Health and Wellbeing have been doing for a number of years, and we know that it works. We value this way of working, where services are delivered locally by local people who understand and know their communities. At the outset, we decided that this was the best approach to take with delivering the Healthy Communities programme. And we're delighted to be able to build on existing partnerships and develop new ones over time. I know this approach is very much welcomed not only by us in the HSE, but by all our partner organisations. Collaboration and partnership working is critical to the successful delivery of healthy communities. Fostering relationships, building on trust, knowledge, and experience will facilitate the effective delivery of these interventions and long-term health gains. Thank you to all our local community development organisations and voluntary organisations for the wonderful work you already do on our behalf, and we look forward to building on that through the Healthy Communities programme. Another essential component of promoting the healthy communities is the commitment of local authorities. Each of the respective local authorities will coordinate and support Sláintecare healthy communities within their local communities to the local community development committee, existing healthy city and county plans, and by recruiting a healthy community local development officer for each of the areas. The Healthy Community Local Development Officer will coordinate activities and existing resources to create a healthy environment, and they'll also work collaboratively with us in the HSE and with our other partner organisations. Health and Wellbeing in the HSE, which incorporates health promotion and improvement, are responsible for implementing and monitoring a number of interventions within these 19 community areas, with the aim to support people to lead healthier lives and to bring about behaviour change where necessary. Targeted interventions will tackle the preventable causes of chronic disease. Initial interventions will focus on supporting people to improve their diet, increase nutrition and physical activity, to stop smoking, reduce alcohol consumption and childhood obesity levels, support parenting, and reduce stress and social isolation. Our commitment within HSE Health and Wellbeing and Health Promotion and Improvement is to provide interventions or services that target the most vulnerable and disadvantaged groups within society, and those most at risk of developing chronic diseases. And by doing this, we will support families and children to get the best chance of living healthier lives. We will ensure that these interventions are evidence-informed, of a high quality, and delivered in a standardised way throughout the country. We will deliver these interventions in partnership with local community development organisations and other existing community groups who understand and know their communities. And we will gather the necessary information and data to evaluate the interventions and measure effectiveness. Using this evidence, we will secure funding so that successful interventions can be expanded to further communities over time, and interventions that are not effective can be replaced with other programs and initiatives. So what has the progress been to date? The management and delivery of each component within the healthy communities would not have been possible without substantial work delivered by Health and Wellbeing over the past number of years. Health and Wellbeing have demonstrated the effectiveness of various programs and initiatives, developed models of care, and supported the delivery of high quality services. This presents a solid foundation on which to build this program. Significant progress has occurred over the past number of months. We've agreed the initiatives that we will deliver. The geographic areas are also agreed. Recruitment has now progressed at pace. Contracting service is happening. We are providing training and supports, building partnerships, and establishing local implementation groups. This progress is due to the huge efforts of many colleagues, internal and external to the HSE, despite the many challenges presented by COVID and the cyber attack and the redeployment of health and wellbeing staff over the past number of months. I would like to thank my own health and wellbeing team, Community Operations Health and Wellbeing, Health and Wellbeing Heads of Service and their health promotion and improvement teams, our colleagues in public health, and our Healthy Ireland leads. I also want to acknowledge the support from our colleagues in the Health and Wellbeing Unit and Sláintecare Programme Implementation Office in the Department of Health. We in the HSE welcome the renewed focus and a targeted approach to addressing health inequalities. We look forward to the year ahead, to fully implementing all intervention in each of the 19 areas, to building a partnership model of delivery, but most importantly, to supporting individuals and families to live healthier and longer lives. Thank you.
Thanks very much, Helen. Well said. So building on that cultural collaboration that Helen was referring to, she also called out the local authorities as a key player in this. And we have Michael Walsh, Chief Executive of Waterford City and County Council, and involved with the County and City Management Association, the CCMA, who will highlight the importance of the interagency piece as well. So we have a pre-record here from Michael Walsh. Thank you very much.
Could I welcome everybody to today's webinar, and just say I'm delighted to represent the CCMA and local authorities generally in terms of expressing our support for this significant programme, which is intended obviously to deliver better outcomes for areas that have been identified as in need of help, is the way I describe it. I'm very conscious in terms of the service that we deliver on the ground, that on a daily basis we impact on these communities, hopefully for the better in most instances, but we equally want it that we genuinely improve the environmental matters generally, and obviously health is very significant in that context for these communities. Space does matter, and the reality is environmental factors significantly affect the quality of life determinants for these people, and obviously health is a really significant one. So we're delighted that Sláintecare would have involved us from the very start in this process. They obviously have very health specific outcomes that they want to improve in these areas, but it's equally fair to say that right across government, including local government, obviously, that there are a whole host of services delivered to these areas. I don't believe there's a government department that doesn't have some bit of function here. For example, health is certainly one of the most obvious ones, but if you think of community safety and the Gardaí and Department of Justice, the education providers, ourselves in the community development space, transport, for example, children's services, employment services, and I could keep going as the reality. Every single arm of government, in a sense, has an impact in terms of these environmental factors. And the challenge for us is to ensure that we coordinate those both at local and national level. The Local Community Development Committee is obviously the intended forum in many respects to achieve that coordination at local level, and there will be a subcommittee driving this in the individual authorities. And equally at national level, there's a senior official committee, which Tom may have referenced. And I suppose the ultimate objective to sort of utopian outcome here would be if we can get a real flow of information running from local to national level and get that joined up government, then we can certainly deliver better outcomes. it's always challenging to achieve that collaboration, but we'll never achieve it if we don't start on the path of doing it and commit significant resource towards it. So we're really, really grateful to Sláintecare for this involvement, and we want to commit as local authorities to seeking to make it better simply for these communities and for all the people that live therein. We're also saying that this is not, you know, an absolute science in many respects, and that there will have to be continual learning, adaptation based on experience in doing this. So we very much view this as the start of a journey. But I think it's a very positive start, and I'd really ask everybody to engage wholeheartedly in it. These communities are some of those with greatest need in our society. And if we genuinely are committed to doing this, we can make a significant difference. So it's in that context that as local authorities, we genuinely welcome this initiative. We're very appreciative of the resources that Sláintecare are making available to us, and we intend to work in real partnership with Sláintecare to ensure that this is positive and progressive and a real game changer for these communities. So again, thanks very much for having me, and equally just encouraging everybody in their participation, and all this dialogue can help to inform better outcomes and the success of this particular initiative. So thanks very much.
Thank you very much, Michael. Michael is Chair of the CCMA and Chief Executive of Waterford City and County Council, and he's been a very important advocate for this work. Next up, we'll move on to the main men themselves, the Minister for Health, Stephen Donnelly, and the Minister for Public Health, Wellbeing and the National Drug Strategy, Frank Feighan. At the launch yesterday that Helen referenced, we had the Minister for Health calling for an ethical and philosophical shift in how we deal with inequalities. He highlighted his own real engagement and commitment to the issues, and Minister Frank Feighan highlighted some of the projects that Tom mentioned earlier that have been developed as part of the once-off fund and the enhancement fund that Tom was outlining earlier on. So we have a short video here from the two ministers, and Owen Keegan from Dublin City Council as well, so we can share that with you.
I'm delighted to be here in Darndale today to be launching the Sláintecare Healthy Communities initiative. It's a €13 million annual programme. It's very exciting, and what it's going to be doing is supporting work between the Department of Health, the HSC, local providers to roll out additional supports in these 19 communities to help address persistent health inequalities.
Local authorities are very happy to partner with healthy communities. It gives us an opportunity to work with state agencies and with voluntary and community groups to ensure that the health and well-being needs of our communities are supported. Healthy Communities is focused on broader determinants of non-medical determinants of health, and it touches on areas where local authorities have a key role, and we can make a huge contribution to achieving the objectives of healthy communities, working with various partners.
It's great to be launching this initiative. It'll tackle the health and well-being in 19 communities around the country. Some aspects, so you have social prescribing, you have smoking cessation, and you have walking and opening up of various walks around the country. So again, we're very, very excited, and we're very, very thankful for all the agencies and all the various stakeholders are buying into this very, very it's successful and very, very exciting initiative.
I hope it is the start of a new way of looking at healthcare and healthcare provision in our country to make sure that boys and girls growing up, that they all have the same opportunities in life in terms of physical health, mental health, emotional well-being. It shouldn't matter where you're from, it shouldn't matter what gender you are, it shouldn't matter how much money your parents have. Everyone has got to get the same chance in life, and at its core, that's what this initiative that we're launching here today is all about.
Thank you very much, ministers, and thank you very much, Owen Keegan from Dublin City Council for their contributions to that video taken at the launch yesterday. So next up on today's webinar, we have a short presentation from Dr. Paul Kavanagh from the HSE Health Intelligence Unit. Paul has been working with us in HSE Health and Wellbeing, providing clinical leadership on the Tobacco Free Ireland programme. He's been very busy as a specialist in public health with COVID, and this year also he's helped us develop the evidence base and the insights that we've utilised for the development of Sláintecare healthy communities. So really appreciate your help, Paul, and look forward to your insights here today.
Okay, Paul, we can't hear you.
Are you with us there, Paul? Can you hear me? No, your sound has just gone there, Paul.
Can you hear me okay now?
Yeah, sounds great.
Okay, great. So look, I'm delighted to be here this morning and to be audible to speak to you about the Sláintecare Healthy Community Programme area, and specifically to talk to you about the work that we led out on in the National Health Intelligence Unit to support colleagues in the delineation of priority areas for the establishment of these programmes, and also to talk a little bit about how health information will be useful in terms of bringing these programmes to life. So this has been touched on already, and I'm repeating it now because it's a really powerful concept underpinning the work that we're describing today. And it's the fact that the physical, economic, social, political environment in which people live their lives has a really powerful influence on their potential to experience good health and to live long, happy lives. And that's a very powerful concept. And it is challenging then to bring that to life in terms of interventions and working with people around their health and well-being. And there's a real opportunity then to look at place where somebody lives their life, and where somebody lives their life across their life course as a platform in terms of intervening and trying to offer people the best opportunity to live long, healthy lives. And the approach that we're leading out on today is very much consistent with the sort of place-based approaches to health and well-being and to addressing health inequalities that are well established in other health systems as well. So this is a very powerful concept underpinning what we're talking about today. We can't think about place, and we can't think about the way that place shapes people's experience of health and well-being without recognizing that not every place across the country offers people a fair and equal chance to experience good health. And I know the CSO today just launched some statistics, including popular names in Ireland over the last year. And here's Grace and here's Jack. And what people may not be aware of is that the CSO have also measured and reported on the fact that depending on where Grace lives, if Grace is living in an area that is more disadvantaged, she will experience 4.5 years less in terms of her life expectancy than a counterpart who's born in a more affluent part of the country. Similarly, Jack will experience 5 years less in terms of his life expectancy if he is born in a more deprived part of the country than counterparts who are born in a more affluent area. So the Institute of Public Health have marked this and they've called out this statistic here, which is that tackling health inequalities could help us avoid 5,400 premature deaths in the country each year. So I think from our perspective, this is a real call for action in terms of what we're discussing today. So when we were called on in the National Health Intelligence Unit to work with colleagues in health and wellbeing in the HSE and with the Sláintecare Implementation Office and colleagues in the department around delineating priority areas to focus the Sláintecare healthy communities, particularly with a view to addressing health inequalities. Our initial place to focus on was to look at the population across the country, and in particular to use a well-established metric, the HP index, a multi-component metric, which uses census data that's collected periodically. So we used the HP index that was generated using the most recent 2016 census data. And that brings together a number of different components of census measures, and it brings these together into a single composite index that can be used to measure the deprivation at a small area basis across the country. And we know then that that measure is linked then with the health experience of people who live in those areas. So there's over a threefold difference in terms of the gradient of health experience between the most affluent and the most deprived areas in the country measured using this HP index. So this was our go-to place in terms of an index using data to try and inform and drive decisions around how do we prioritize and delineate communities that we would focus on in the first wave in terms of the establishment of these Sláintecare Healthy Community Programme areas. So this slide here is showing you some of the data that we mobilized. So we moved through the country, we gathered information on the HP index, on the population size and age structure across the country at a small area level. And then we used that in conjunction with other information and other criteria such as the spread across the country, population age structure and size, and also alignment with local community partners who will be so important in terms of delivery of the Sláintecare community programme areas to delineate areas that would be prioritised in the first instance in terms of the establishment this year of the first wave of Sláintecare Healthy Community Programme areas. So through that work then, we were successful. If we use a cutoff of -10 with this HP multi-component deprivation index, and if we use that cutoff of -10 to identify those areas that are much more deprived, we were successful in aligning and focusing the delineation of the first wave of Sláintecare Healthy Community Programme areas. And we were able to capture within these areas over 8 out of 10 people who live in some of the most deprived parts of our country. So I think that's a great foundation, a great first step in terms of the establishment of this programme. So that's how we used information in terms of the delineation of the 19 different areas, just showing maps which illustrate some of these areas here now. And the next thing that I want to highlight is that we've also worked here in the National Health Intelligence Unit, in addition to delineating the 19 Sláintecare Healthy Community Programme areas, we've also worked to develop some information assets and supports that will enable colleagues who are on this webinar this morning to bring these communities and the work of the Sláintecare Healthy Community Programme area to life. So we have developed a range of information assets related to each of the 19 areas, and I'm highlighting this here. So we have population information, which describes the age structure and also gives information on health status and a range of information on the wider determinants of health. And we've also done some work to start to mobilize some of our survey data and to try and organize that and develop some estimates in terms of the quantum of people with different health risks or health benefit behaviors, and also people with different morbidity statuses as well. So that information is available through Health Atlas as part of a package of information that we have available to support the establishment of these areas. And finally then as well, this slide here just calling out that within the Health Atlas Ireland system, there is capability established there to map these areas. So to understand the population and to understand the population relative to a number of different health assets. So calling out on the map here, GP practices, health centres, mental health facilities, and a range of other assets that will be relevant as well. So we hope that this will be a very powerful resource for colleagues as they start to bring these Sláintecare Healthy Community Programme areas to life. So information, we think, will be very important in terms of getting started, in terms of the initial planning and development of these Sláintecare Healthy Community Programme areas. But of course, they'll also be very important, as Tom called out, in terms of monitoring and evaluation to learn lessons and ensure that we're delivering impact for local populations. And look forward to having conversations with Tom and the department and other colleagues in terms of what we can do to strengthen our health information environment to ensure that it is optimized and useful in terms of the Sláintecare Healthy Community Programme areas. I think over the last 18 months with COVID, we've really learned to value health information as a key asset within the health system. And I think it's important now that we invest, develop, manage and utilize health information to have the best impact. And just calling out here a number of areas that we would see as being key priorities for the department as it closes out its work in terms of developing a national health information strategy to make sure that we're optimizing this key asset in terms of the health system. So finally, just bringing us back to Grace and to Jack as well. So important for us to bear in mind our purpose today in terms of the launch of the Sláintecare Healthy Community Programme areas. From our perspective within the National Health Intelligence Unit, we've been delighted to work with colleagues in the HSE and in the Department of Health in terms of the initial kind of scoping and preparation for the launch of this initiative. And we very much look forward to working with colleagues in the HSE and of course our wider partners as well, particularly in terms of our role around helping people to mobilise health information to bring the ambition of the Sláintecare Healthy Programme areas to life and to ensure that we realise a measurable impact on health and well-being and on health inequalities. So thanks very much.
Thank you very much, Paul. That was an excellent presentation. Really appreciate those insights and obviously highlighting the importance of evidence and information. And that was one of the things that the Minister highlighted, Stephen Donnelly, at the launch yesterday. And I heard my boss, Helen Deely, there that you heard from earlier on, talking to him about how that is a focus of what we're looking at now, and it's definitely going to be something that we need to integrate into the rollout. We're going to do an evaluation and gather evidence so we can seek further rollout and be able to speak confidently about our achievements in this area. So now we're going to move on to more detail about some of the components in Sláintecare Healthy Communities. As you heard earlier on, the whole idea of this is that it's multi-component. We know that the issues that we're trying to target are multifactorial, so we're taking a multi-component approach. So we're going to start with parenting. So we have a small panel discussion. Last Monday, I had a quick chat with our own Anne Pardy, who's the lead on the HSE Healthy Childhood Programme, Joanne Turbert, a family support worker who delivers parenting programmes as well as supporting parents on a one-to-one basis in Brill Family Resource Centre in Waterford, and Catherine O'Donoghue from Tusla, where she leads out on the parenting piece with that organisation, who've been a key partner for us. So if you can play that video there, Leo, I'd appreciate it. Thanks very much. Thank you, everybody, for agreeing to be a part of this panel around the parenting programmes, which are a key part of Sláintecare Healthy Communities. Anne Pardy, if I can come to you first, why is promoting parenting seen as a fundamental part of health and wellbeing?
Well, Fergal, this is incredibly important. Basically, investing in early childhood through families and communities is an incredibly smart investment. We know, and it's well researched and well studied, that the foundations of virtually every aspect of human development, so whether it's physical, intellectual, emotional, they're laid in early childhood. So really, by supporting parents in their parenting role, this is a direct investment and excellent value for money.
So, Catherine, I suppose from Tusla's point of view, there's a lot of alignment with that purpose.
Absolutely. I suppose we all know that one of the most effective ways of supporting children is by supporting their parents to get the support that they need in their role as a parent. We know that parents, have different needs across the continuum. And I think, this particular initiative, has identified a number of areas where parents might need a little bit of additional support. So within TUSLA, I suppose we have a number of initiatives that we look at to support parents, across the country. So we're currently actually revising our new 5-year strategy. So parental participation is a key part of that. And also the collaboration, of working together is also really crucial in that. So it is absolutely about if we can reach parents where they're at with the needs that they have and give them the most, I suppose, appropriate service at the right time, we'd be doing really, really well.
Very good. And Joanne, you're working in a family resource centre on the front line, as it were, with parents. What benefits do you see that parents get out of parenting programmes?
Well, I suppose similar to Catherine, when parents come into ourselves for family support, when they come so early and can get help at the early stages, it gives them a great chance to start getting on with their lives, making improvements, reducing things deteriorating further and bigger problems occurring later on. We can catch things right when they're happening and get everybody back on track and prevent further problems down the line, I suppose.
Thanks a million, Joanne. Coming back to you, Catherine, in terms of the collaboration that's happening here between TUSLA and the HSE and other community agencies and the likes of the Family Resource Centre that Joanne works in, what's been your impression of how that's worked under Sláintecare Healthy Communities to date?
Yeah, so this, I suppose, for me is a really good example of how organisations work together. So for this particular initiative, TUSLA and the HSE worked both at a national level and at a local level to work through this process. So I suppose within TUSLA, we've particular structures in place that really helped that under the area manager structures. So we have a prevention partnership and family support service in each of the areas. We have child and family support networks, and we have our children and young people services committees. So I suppose what really worked was we had then the knowledge and expertise from both the national level within TUSLA and the HSE, and then the local on the ground knowledge and experience in relation to the different service providers that we have in each of the areas. So overall, I think this is one really good example of how even going forward to use, I suppose, the expertise of both organisations, because at the end of the day, we all want the same thing. We all want parents and young people to get the supports and services that they need, at the right time. So definitely this particular initiative was a really good example of that collaborative work and relationship.
And Anne, from the point of view of the HSE National Healthy Childhood Programme, I'm sure it's ticking a lot of your boxes as well. I see your mychild.e advertised behind you there.
Oh, absolutely. No, we were delighted to see this initiative happening, and really that healthy communities, healthy adults starts with healthy children. So our core National Healthy Childhood Programme begins with seeing, so there's a well mandated programme of contacts for every single child. So literally every baby born in Ireland, continuum of supports seen by public health nurses, community medical doctors. So very good structures now in place and very good, I suppose, standard of that programme. But through that programme, while there's often a lot of focus on, I suppose, the physical and the health components, parents' parenting needs, support, advice at a very universal level was identified through both the practitioners who work with them. But I would also say we had an opportunity through the Nurture programme, the Atlantic philanthropy funded programme, to engage a lot and actually to hear a lot directly from parents. So they would have told us that they wanted an evidence-based go-to source of information, and hence the growth of My Child, as you'll see in the background. And I suppose we see that as just providing not just the out of hours, the queries you have, some supports that direction, but also this is very, very much reinforced in the context of progressive universalism. So that key role of the public health nurse, the advice they give, identifying and perhaps sometimes themselves giving more additional supports and sometimes needing to refer onwards. So and also just when I mentioned mychild.ie, we would also encourage parents to look at Parenting 24/7, the TUSLA site. So it's very much another example of HSE and TUSLA working in partnership.
Yeah, when you mentioned all those things, there's so many moving parts for parents and children. I suppose it's very true to say it's not a one size fits all when you're trying to address the issues of parenting. So how do you think our programs here under Sláintecare Healthy Communities and the parenting piece is trying to respond to that?
Maybe if I begin,
Catherine,
go ahead.
Okay, yeah, I'll come in for, and I'll go back to you, Anne. I think we mentioned it earlier, parents, I suppose, have different levels of need. So sometimes it's literally information. Parents just need particular information at a particular time. And then the higher level, I suppose, is, maybe a specific type of intervention. So in this particular, I suppose, initiative, as we know, particular areas were identified to meet the needs, and we have identified evidence-based programs to roll out in these areas for parents to, I suppose, access. And again, they will be done, I suppose, in a combination through potentially face-to-face or online. So I suppose what we're trying to do is meet the needs of parents. And we've learned through COVID actually that some parents actually like to access supports online, where other parents like to access in the physical face-to-face, in the physical space. So I suppose that's what we're trying to do in relation to flexibility. But as Anne said, parents are looking for, evidence-based programs that they can attend, that they can learn, and then obviously in turn that they can use in their role as parenting with their children and their families.
And do you want to follow on that?
Yeah, I would absolutely agree. And I suppose it is that notion. And one of the real merits of this program is it has a very universal focus. So while, as you'll have heard, areas and communities with additional needs were identified to drive maybe the significant investment, there's a very, very strong focus. And we would certainly have lots of feedback to say that there isn't a parent in Ireland that couldn't do with some bit of advice and support. And, we're bombarded with information. I mean, there's more guidance out there now around how many hours a child should sleep, screen time, food, exercise, etc. So lots of competing demands, lots of information. And sometimes just getting to a seminar or a parenting program online or in person can actually just help you with how do I make that happen in person? How do I actually make that part of day-to-day practice in the household, at home, busy, lots of things going on. So starting at that baseline level, and I think that's important, and then building on to meeting additional needs, the type of services that Catherine or Joanne might refer to.
And Joanne, I'm sure you see a variety of different needs coming in your door there in your Family Resource Centre. Can you tell us a bit about that?
We certainly do. Well, people are welcome to come in to us, and we give them an hour to speak when they come in the first time and an hour the second time, and together we gain an understanding of the problem that is going on for them, and then we work in partnership with the person that is there. Like Catherine was saying, sometimes people need evidence-based support and advice, and they really just don't know what to do to fix a certain problem. Other times their problem is different and they need specific interventions, or they need to be linked to intensive supports, and we do our best to get them for them. Some people have no transport, so we see if different professionals will come to our centre and work out of the rooms that we have there. Often people, a lot of their time is spent dealing with different professionals. So what we do is we get all the professionals together in one room with the person to make the best use of the person's time, and then all work together collectively with the family and collaboratively to try and sort the problem that way. Like Anne was saying earlier there, eventually we would hope that things get better for the person, and usually they do. And then people can link to our universal supports, and they would all be focused on well-being and healthy lifestyles and some of the other stuff that we're talking about here today. So it kind of comes full circle, really. People come, they're in very severe difficulty, things get better, they help each other, they meet other people, and then eventually their lives start to get back on track, and getting then in touch with healthy living, well-being, self-care are all what keeps things improved and keep people progressing again, I suppose.
Thanks you very much, Joanne, and thanks everybody for that. I really appreciate your inputs on the panel today. Thank you very much indeed. I really appreciate, I want to second that again, like the insights that the guys gave us there, and their, their approach and engagement on the issue of parenting is inspiring, really. And we wanted to set the scene for some of our insights on our health and wellbeing programs coming in under Sláintecare Healthy Communities with the parenting piece, because it's the fundamental bedrock of so much of our health and wellbeing. So really appreciate that. And referenced the progressive universalism. And I think this is something that's at the core of Sláintecare Healthy Communities. We're trying to do things for everybody in terms of health and wellbeing in Ireland. but we also need to target particular communities, and that's exactly what we're doing, or we've been enabled in an interagency way to do under this new programme. So next up is a short piece on the Making Every Contact Count initiative. Now, this initiative is about getting our health service staff to mainstream brief intervention and brief advice for their patients and service users on a couple of different areas of health and wellbeing. So as many of you will know on today's webinar, the advice and direction from a trusted health or social care professional can have a huge influence on people's motivation to engage in behaviour change. So let's listen to Vanda Williams, one of our health professionals, describe how they do it.
To Make Every Contact Count, it's a HSE programme aimed at us having meaningful conversations with our patients and helping them to try and make healthier lifestyle choices so they can improve their health and their well-being. Evidence shows that by making healthier lifestyle choices and changing potentially harmful behaviours, it can prevent people developing chronic diseases. During routine consultations, we offer patients opportunities to discuss their health behaviours and consider ways to choose healthier options during their day-to-day routines. The areas covered include smoking, alcohol, physical activity and healthy eating. This involves patients answering a short set of questions about their typical behavioural patterns in one or all of these areas. Both the patient and their health professional agree a course of action and what steps to take to change a behaviour. This may include signposting to HSE Quit services, looking up information on the Ask About Alcohol website, joining a local park run on a Saturday morning, or sharing a copy of the Healthy Food for Life booklet. As a health professional, this is a great way to help and encourage patients to make changes to their behaviour that will ultimately give them the opportunity to live a healthier life. I find the majority of people are open to having conversations and discussing the best way to make these changes. This is very much a patient-centred initiative where people set their own goals based on their needs and preferences, and they're offered information about services and supports to help them on their journey to a healthier life.
Thank you very much, Vanda, for your time in making that video with us. And I just want to highlight to any HSE staff or health professionals out there, if you want to undertake the MEC training, go to makingeverycontactcount.ie website to get initiated with that program. We'd really appreciate as much as support as we can get on it. Also, just to highlight, if you're on Twitter, that we're, if you want to share some information that you've heard today or promote the program, which we'd appreciate that if you would do that. We're under HSE Health and Wellbeing on Twitter, and the hashtag is hashtag Healthy Ireland and hashtag Sláintecare Healthy Communities. So next up, we want to meet our lead for the Healthy Eating and Active Living program in HSE Health and Wellbeing, Sarah O'Brien. If I can invite you up here, Sarah. I want to talk about healthy eating and nutrition. Thanks very much for your input here today, Sarah. So what does Sláintecare Healthy Communities mean for your area work? I can't hear you there. Sorry, Sarah. Is it me or is it you? No. Can you get adjusted there? No. We can. No. Okay, so look, we'll go to the video, and we have a video here on Healthy Food Made Easy. So we have a couple of new components landing in relation to.
I'm sorry, Fergal. Oh, yes, apologies. It was a different button that was switched. Sorry about that.
You're fine. You're fine. So the question I asked there, just to give you a second to take a breath. What does Sláintecare Healthy Communities mean for your area work, the healthy eating, active living space?
Yeah, so it's great to be here, Fergal, and thank you very much for giving me an opportunity to talk to you. I suppose the Sláintecare Healthy Communities Initiative is really exciting for us. We know that the very high levels of overweight and obesity in Ireland and their impact on health is a significant challenge for both individuals and the health services. And here in the HSE, we're putting a significant focus on addressing this. Earlier this year, we launched the model of care for the management of overweight and obesity, which sets out how services to prevent and treat overweight and obesity for children, young people and adults are to be developed and delivered. And I suppose importantly, we know from lots of research, both national and international, that obesity is not just about health behaviours. At an individual level, our weight, whether underweight, healthy weight, overweight or obese, is affected by our genes and neurophysiology, which is a big word for saying essentially our brains and hormones. But the environment that we live in also has a significant impact. So while we're putting a strong focus on tackling overweight and obesity in the HSE, we know it's not something we can do on our own, and that's why Sláintecare Healthy Communities is so exciting. It means not just will we have enhanced health and wellbeing programs available to people in communities, but also a really good new level of coordination and focused work with colleagues in local authorities and other local partners to address some of the really important environmental issues. For example, how the local built environment and transport infrastructure can help people to be more active every day. And I see in the Q&A chat there, one of the participants was highlighting some of the initiatives and changes that could be made in the transport infrastructure to help older active adults to be active in their communities, and also how initiatives can be put in place to make it easier and more affordable for people to access local healthy food. And as well, I suppose, just to put it in the bigger context again, through the Department of Health, Healthy Ireland Strategic Action Plan, we're also really looking forward to seeing further work happening at a national level to tackle issues such as marketing and promotion of high fat, salt and sugar foods. So it's very much trying to get a whole of society approach in place.
Great. So specifically in relation to healthy eating, where are we going to see the rubber hit the road in these 19 communities?
Yeah, well, I suppose from our perspective, we feel that all the activity and enhanced services and coordination that will happen in the 19 communities through Sláintecare Healthy Communities will contribute to creating healthier environments for everyone, whether that's in preschools, schools, workplaces, or in community spaces. But specifically, I suppose it's really positive to see that the Healthy Food Made Easy programme, which I know we're going to hear a little bit more about in a few minutes, is going to be more widely accessible. It is already well established in a number of areas around the country, but it's fantastic that more people will be able to access this really great community programme. And another element of the Sláintecare Healthy Communities is that, I suppose, in addition to the post that was referred to in the local authorities, working with local partners, we will be putting a community food and nutrition worker in post, and they will work with local communities and organisations to put evidence-based programmes and initiatives in place that respond to local need, that will help improve community and individual nutrition knowledge and skills, as well as improving access to healthy food, healthy and affordable food. And this is a new and innovative approach. So we're really looking forward to seeing its impact in communities and the innovation that will arise from it.
Great. Okay. Well, look, we'll leave it there. We'll move into the Healthy Food Made Easy video. We have a video from the guys in CHO7 and some of our partners here. So we'll just play that, and it kind of explains itself and gives some quality insight into what Healthy Food Made Easy is all about. Thanks, Sarah.
The HSE funds Healthy Food Made Easy because it's an important health promotion programme that's delivered out in the community. It gives people the opportunity to test out cooking, to cook on a budget, to prepare meals, to look at labels, and it is an important strand of a range of health promotion programmes that are delivered out in the community with our community partners. In our community healthcare area, we work with South County Dublin Partnership and Ballyfermot Chapel Lizard Partnership. They have easy access to their communities, they know the area, they know the people, and they know the programmes that work well in their communities. The programme is delivered in the community through the Healthy Food Made Easy coordinator. They work with the local partnership company or community organisation, and it's delivered through the peer leaders. Even if you've never cooked before, you can pick up some practical tips and ideas to learn how to cook on a budget, to learn about fat, to learn about fibre in your diet, and to learn about labels and all those practical things that can make healthy eating easier. You can access this programme through your local partnership company and community organisation.
The programme consists of 6 weeks. So week 1, we look at the food pyramid, and within the food pyramid, we go into detail about each shelf and look at portion sizes and serving sizes of each group. Week 2, we look at fibre. We look at the foods that contain fibre and talk about how we can increase fibre in the diet and why that's important. Week 3, we look at fats, foods that have good fats in them and bad fats, and people gain an understanding of how to choose lower fat products when they're shopping. So week 4, we look at food across the different lifespans. So we look at food for children, food for adults, and food for older adults. We explore the barriers that people face when cooking alone and the barriers that families face cooking for children who are fussy eaters. We use group discussions to allow people to come to the conclusion as to how they can make healthier choices for their families or for themselves. Week 5, we look at smart shopping. We look at the psychology of the supermarket and how people can make shopping lists and be more organised so they can make the healthy choice the easiest choice. We talk about food safety and freezing food so people can have easy options there for their family or for themselves when they want to go and choose a meal. On our final week, we look at the behaviour change cycle. We reflect back on what we've learned and the skills that they've gained throughout the course. We talk about how they can make changes sustainable long after the programme. When people finish the course, we would hope that they'd have a new appreciation for how to eat healthy. We'd hope they have gained new skills, both cooking skills, and have gained a better understanding of healthy food. They have their label reading skills, so they are confident when they go out shopping that they're going to shop and cook and eat healthy food. Healthy Food Made Easy is a warm environment for community members to come along, learn about healthy food, do some cooking skills, and all work together as a group to hopefully come out with some new knowledge about how to eat healthy.
What made me want to do the course is to get healthy again, because over the years I have went off track. So a friend of mine gave me the number of the course to contact. The best thing I took from the course was taking me back to basics, and when I was taken back to basics, it made me realise that I had been making some silly food choices. I found the food planning very good in the programme because I found that if you plan your food, you will eat better through the day. Once I've done my cooking for the day and I've prepared all my food the way I would like to, then it will save me from eating so much crap. I used the food pyramid when we were in primary school, and then over the years I had forgotten about the food pyramid. When I took the course up to Healthy Food Made Easy, I actually was surprised to see the food pyramid again on it, and I was so happy with it that now I'm making my choices from the pyramid. When I finished the course, I got a great sense of achievement. I'm cooking more, I'm planning more of my food, and it's making me feel better in myself. It's really changing my life.
So HSE community dietitians are involved in the Healthy Food Made Easy programme because we work with the organisations that deliver the programme on the ground. So we help them to identify potential peer leaders for the programme. And when they've been identified, we train them up to deliver it. And then on the 5th week of the programme, as they're delivering it, we will go out and visit and answer any nutrition related questions that have come up during the course of the sessions. So we also would provide those peer leaders with periodic refresher training, and we also renew and review the resource materials for the programme. The power of the Healthy Food Made Easy programme is that it allows a small group of like-minded people to come together for a short while to discuss and reflect on their eating habits, using a range of activities that are facilitated by our trained facilitators. And over the course of the sessions, many people come to reflect and decide to make positive changes to their eating habits. So that could be something very simple, like increasing the amounts of fruit or vegetables they're eating, or it could be reducing the amount of takeaways they have. But often then that is also happens in their whole family environment. So when those changes are sustained, you have a situation where whole households have improved their eating habits as a result of one person coming through the Healthy Food Made Easy programme. So that has really got a large impact on their health and the health of everyone in the household.
Thank you very much to Sue and Edel and Roisin and Karen for their input in that video. I thought they did very well for us, and it was interesting to see the relationship that Sue and Roisin had. There obviously was a lot of trust built up there between the facilitator of the program and the participant, which is great. I suppose we can't expect people to change behaviours if we don't feel good about themselves, and that relationship and that warm, engaging way that so many people have in relation to health and wellbeing at community level is just an essential piece. So I'd like to welcome Martina Blake, our tobacco lead, onto the stage. Martina, thanks for coming on. So there's a couple of pieces in this around tobacco. So you must be delighted with the injection of services that's coming with the Sláintecare Health Communities for your area of work.
Yeah, absolutely. We certainly have made huge inroads in terms of reducing smoking prevalence generally across the population over the last 5 years, but smoking prevalence is remaining stubbornly high in some deprived communities. So it's as high as 24% in some communities versus 14% in more affluent communities. So, you know, where smoking prevalence remains high, you know, health inequalities prevail, and we absolutely need this kind of targeted investment, and it's really welcome from the department in terms of the Sláintecare Health Community initiatives to try and have a more targeted approach. So like this investment is going to see, you know, HSE stop smoking advisors in post in these communities, but also peer stop smoking advisors working in the community, delivering a program called We Can Quit group support program, which you'll hear about in the video shortly. And, you know, uniquely, I suppose, about this program is that we're going to be providing, and we have funding set aside to provide free stop smoking medication to anyone accessing a service in these communities. So that's removing that barrier of accessing nicotine replacement and Champix, the drugs that really help. And we know that when people access behavioural support and stop smoking medication, they really increase their chances of quitting successfully.
So one of the pieces is that we're getting new stop smoking advisors to target these areas. So tell me about what those guys do.
So the stop smoking advisor, be they a health service staff or a peer stop smoking advisor trained to the same level, what they will do is sit down with somebody, talk through their smoking history, complete a nicotine dependence assessment, you know, try and assess how addicted they are to nicotine, talk to them a little bit about their previous quit attempts, what they used in the past, what their smoking triggers are, try and work on the emotional you know, link that they have with smoking, the psychological link and the physical addiction. And help them make a plan. Preparation is really the important key part of quitting. And, you know, they'll help them to make a plan. And then after they have kind of encouraged them to set a quit date, they will engage with them and talk to them each week for a month, and then again at 3 months and again at 12 months. And they can interact in between those times as well if they need to. So they're going to provide them with a range of supports over a 12-month period to try and get them to where they need to be.
Great, it's fantastic to be able to offer people that one-to-one support. I know from talking to smoking cessation advisors over the years that they end up talking about lots of things in people's lives that are impacting on their behaviours.
Absolutely. I mean, there's you know, I suppose smoking is tied up with so many other things, and you know, it's kind of routine, the habit, and you know, people you know, with low incomes, you know, stress and all of those things. So what they will do is, I suppose, is kind of address all of those things and help them to identify better and healthier ways of managing stress and managing the day-to-day struggles that they have, you know, in their lives as well.
Okay, so look, I know that you're trying to roll out tobacco-free environments through your partnership working as well. Can you tell us a little bit about that?
Yeah, I mean, we know that tobacco-free environments really help people who are trying to quit and prevent relapse as well. They obviously provide, you know, smoke-free environment. You know, secondhand smoke, as we all know, is a Class A carcinogen. So obviously they protect people if there's no smoking. But the main thing, I suppose, is that, you know, we know that where children witness adult smoking, you know, they are more likely to become smokers themselves. So the more environments that we can make, you know, public spaces, parks, playgrounds, even smoking in the home, if we can reduce adult smoking and that role modeling, positive role modeling by parents, we were talking about parenting earlier, that really helps to prevent smoking initiation among children. And we've done some really fantastic work over the past number of years with some local authorities and Corlin and Nogue organisations. There's a campaign called Not Around Us that was developed a number of years ago in Limerick and has now grown and is expanded to other areas of the country. You know, it's around kind of, I suppose, developing playgrounds and parks, you know, where adults are encouraged not to smoke around children. And that won a WHO award, and we're really proud about that, and we'd love to see that grow across the country.
Okay, thanks very much, Martina. We're going to show the video now around the Week in Quit, which kind of explains itself. And this is a really dynamic way of working with people in group situation to get them to support them around quitting tobacco. So we'll play that video now, and thanks for your input today, Martina.
Thank you.
The Week in Quit programme is a 12-week evidence-based programme that sees that structured support is the best way to support people to quit smoking. It is delivered within the community, supported by a number of community organisations, for example, family resource centres, community centres, lay health workers, community workers. So it's peer support, it's support from community facilitators, who many are ex-smokers themselves. It's the support in the actual group setting, and it's the one-to-one support. And in addition to that, there's also the access to the free stop smoking medication. So you've got the behavioural support combined with the medications as well. So Week in Quit was originally developed for women, but there have been key developments to the programme in 2021. The programme is now also available to men-only groups and to mixed gender groups.
So I'd been smoking for 30 years, and on the GP visit, every time she'd ask me to quit smoking, and she came to me this time with the information about the Week in Quit programme and asked me would I be interested, and I said yeah. I was never able to do it alone, so I think with the Week in Quit programme, because it was going to be with a facilitator and other women, I thought the support would be the one thing that would probably help me through. I think it's the best option out there for somebody that doesn't want to do this alone. The support, the camaraderie, the nicotine replacement, it all combines together to give you great support. Anybody, you never have to quit on the first day, so even just going along to that first night and seeing how you feel, seeing if it's for you, you don't quit till week 2 or 3. So you have the opportunity just to get to know the course before you actually commit. I'm now quit 5.5 years, and my bloods have changed, my cholesterol has gone down, my heart rate is perfect, my blood pressure is perfect. I was so proud of myself that it gave me the confidence to go out and try new things. I'd never be afraid now to try new things. I changed careers, I've done training in other areas. My confidence has greatly improved because I've actually quit smoking.
So I really enjoyed the course that I done. I felt it was very, very worthwhile. And the facilitator, when the programme was finished, asked me would I be interested in training to become a facilitator. And I thought absolutely, it'd be lovely to give something back. An example of the support we would give would be we have guest speakers come in, maybe talk about stress and how to manage stress. We might have somebody come in and give us a little talk on physical exercise and our mental health and mental well-being, so we'd support them that way. I would also do a phone call or text message every week outside of our weekly meetings, just to let the participant know that I'm there. Do they need anything? Is there anything additionally support-wise I can do to help them? And as the weeks progress, as we as facilitators take them through the programme, you can see their confidence grow and they get a great sense of pride, and I think for me it's probably the most rewarding part of my job.
Part of this new Sláintecare Healthy initiative is to promote tobacco-free environments. We know that where there are environments that are smoke-free, it makes it easier for people to quit, and it makes it easier for people who are trying to quit to stay quit. The Week in Quit programme has been evaluated successfully, and we know that if you used evidence-based supports, stop smoking medication and quit for 28 days, you're 5 times more likely to quit for good. So we have a wide variety of stop smoking supports for anybody who wants to quit. You can go on to our website, you can sign up for a quit plan, you can call the phone number 1800 201 203 and talk to an advisor. You can also make an appointment with a stop smoking advisor, or you can attend a virtual clinic. I'd really like to thank the Irish Cancer Society, the partner organisations, the coordinators and the facilitators and pharmacy partners who have worked with us to develop Week in Quit and who are still working with us to grow this programme nationally.
Thank you to Martina and colleagues for that the video input on the We Can Quit program. And it's interesting to pick up the theme, as you heard from the participants or the service users in both the We Can Quit video and the Healthy Food Made Easy video, how transformative a behavior change in one area can be in their lives, that they're, you know, that it's very, you know, it passes on to other areas of their life. And as we heard from the Healthy Food Made Easy, you know, you can impact on the whole family with a behavior change of one person. So very inspiring pieces. If I can bring Anne Sheridan up on stage now for a brief chat. Anne is our program manager for mental health and wellbeing. Hi, Anne.
Hi, Fergal.
So Anne has been, for many years now, been a really strong advocate for social prescribing. And this is a, you know, a very important component of the Sláintecare Healthy Communities program. So Anne, I know that some of our audience are really familiar. We have a lot of social prescribers on today. Could you tell us a bit about what social prescribing is all about?
Okay, thanks, Fergal. It's a pleasure to be here this morning. I'm delighted to hear that there are plenty of social prescribing people in the audience. Though, for those of you who aren't so familiar though with social prescribing, I'll just tell you that the movement really has been gathering pace in recent times. But the truth is that social prescribing has been around in this country for quite a while now. Started back in about 2012 and 13 with projects in Mayo and Donegal. So essentially then what social prescribing is, it involves linking people to non-medical sources of supports in the community. It's at a very simple level, that's what it is, but the effects and the impacts on individuals can be really profound. So it means that if somebody is referred, a person is referred from a GP or another health professional, or in fact a person may refer themselves to a social prescribing link worker who meets the person, figures out with them what their needs are and what community-based support would best meet that particular need. The focus in social prescribing is very much what matters to the person rather than what is the matter with the person. And that's a really, really important distinction, I think, to make. Social prescribing is always delivered, as many of you know, in partnership with community organisations, typically family resource centres or local partnership companies. And the truth is, without this partnership, social prescribing wouldn't really be possible. I said already that it can have a profound effect on individuals. There is evidence, most of the evidence that we look at the moment is coming from the UK, but some also from Ireland in recent studies. And we know that social prescribing can really improve the mental health and well-being outcomes for people, can reduce depression and anxiety, and reduce the experience of loneliness and isolation. And I think you would agree that particularly in the time that we've just experienced, that feelings like loneliness and isolation probably have been exacerbated for a great many people over the last times, and may also be particular features of people in the healthy communities that we're talking about here today. Social prescribing also has the benefit, though, to benefit have wider health service benefits as well. We know that it can reduce presentations to GPs and emergency departments, and probably to other services as well. And we're working in Ireland, in the HSE here, to build the evidence base in Ireland. And last year we launched a minimum outcomes framework, and that's available actually on the HSE website for anyone who's interested. But aside from the ground up movement, there have been other things that have happened in recent times that really matched this kind of ground up movement. So social prescribing is now a national policy. So it's a programme for government, Sharing the Vision, Healthy Ireland, and the forthcoming HSE mental health promotion plan. And that's really important now, that you have that kind of top-down support as well as the ground-up support. The Sláintecare Integration Fund has also really supported this development. And just earlier in the summer, we launched the HSE Social Prescribing Framework, which will guide kind of a more consistent and integrated approach to social prescribing as we go forward. And that's been pivotal in the Healthy Communities initiative in terms of the social prescribing aspect of that. And the final thing I'd say there is that there's an All-Ireland social prescribing network as well. And that allows us at a whole of Ireland approach looking at and sharing the experiences and learning both sides of the border. And that network is really important, I think, as well, in terms of the overall development of social prescribing. So just what I'd say is, all things considered, Feighan, the future is looking very bright for social prescribing, I'm happy to say.
Great. So you're happy to see the social prescribing landing into these 19 areas in a targeted way as well, to build on the existing project.
Yeah, absolutely. I mean, at the moment, there's over 30 social prescribing services across the country, and most of them have been relying on short-term funding. The Sláintecare Healthy Communities programme changes this, because the inclusion of social prescribing now is one of the mainstream health and wellbeing programmes that's going to be delivered under the Healthy Communities programme. Really will have a significant impact now on really securing the development of social prescribing. On a practical level, it's going to result in a full-time social prescribing service in each of the healthy community sites. This translates immediately to 19 full-time social prescribing link workers across the country, led by the head of service health and wellbeing at a local level, and delivered in partnership with a community organisation. At a national level then, how we'll support that development is, we have just developed core essential skills training for social prescribing link workers. This is the first time that there's been any training in social prescribing available in this country. We're also going to develop some resources to enable the kind of referral pathways. So we want GPs and a whole range of others, health professionals, to refer to social prescribing. So we'll provide some resources that will enable that. And we're also going to procure a software program that will also help the individual social prescribing link workers in the day-to-day administration and management of the job, but also support the overall kind of monitoring and evaluation of social prescribing.
Okay, so look, we have a little video, and we're trying to get the service user voice into this webinar today. And I know you did some service user videos for the launch of your framework earlier this year. So would you like to introduce this video for everybody today?
Yeah, I'm delighted to introduce to you two experts that you will hear from. One is Deirdre Ruan, who is a social prescribing link worker in Tala, and she's going to talk to you just about her role. And also Frank Price, who will tell you about his journey with social prescribing. So I think you'll really enjoy listening to both of them.
My name is Deirdre Ruan. I'm the Social Prescribing Coordinator with South Dublin County Partnership. It's actually a great service to have available in the community, because I'm like the conduit between the primary care team and the community services. So the aim of social prescribing is actually to link people with local services. So typically I receive my referrals via a software, a social prescribing software, so it arrives into my inbox, and I get all the information I need to know about the person. So then I ring up the person, and through a series of chats and talks, we discuss what concerns they have, and I kind of do a general well-being score to start off with, and they tell me what their goals are. Maybe they'd like to make changes in their life, or they'd like to find a new purpose in their life. Now these people can be any age, over the age of 18 upwards, so it's for everybody. So social prescribing is very much the first step for somebody that mightn't have been engaging in community activities before, and it facilitates that engagement. The social prescriber will be with that person for a period of weeks once they're referred by their GP or local community service, and they'll stay with them until they get engaged. And that's invaluable to be linked with local supports. And also it can reduce the number of visits to the GP, I suppose, because their health and well-being is much better, linking in with courses like connecting with nature, being out and about, particularly during COVID, linking in with walking groups, and we call that the green prescription. And for all social prescribers, it's probably been the most important thing that we all can link in with and we all advocate.
My name is Frank Price, and I was with Dr. O'Connor's surgery for a long time, but one day I went to the surgery, asked me about walking, was I interested, and through that I was introduced to social prescribing. And it was from that then I took up the walking once a month with the group. It lasted for a while, but unfortunately COVID came along and I had to learn how to get into Zoom, which I had never done before, so it was a whole new aspect for me. And each Friday then we would do the Zoom meeting. And then one day we decided that, you know, after a couple of months on the media, that we do virtual walking. So for a bit of fun, just to get out, you know, we thought, well, let's all get together. Let's do virtual walking in the house, up the stairs, in the garden, wherever. And we'll add them together and we'll make the mileage. And we got down to Tramore, which is where I like being. So through it, we got to know each other, we got to know places, and it was very enjoyable. Very relaxing being able to do it, because once I was talking about Tramore, or people were talking, you could visualise yourself into place and it relaxed you more. And then from that, we said we'd walk around Ireland. And then we went on to WhatsApp, which we learned how to do WhatsApp. And we sent each other pictures of nature, pictures of people baking and different things. And that in itself was great. You know, social prescribing, I would recommend it to anyone. You know, it's really a way forward. It's better, although you're going to your doctor, it's a better tonic than the medication they get, you know, to me.
Thank you very much, Anne, and everybody that participated in that video. I think we'll take the lead from that last line there, that social prescribing is the tonic, better than any medication. So when social support is a tonic, you know, you can't have it any better. So that was really strong point made at the end. So the next thing we want to highlight are the integrated alcohol services that have been developed as part of Sláintecare Healthy Community. So we have 2 of these developed this year, and we have a short video explainer from the horse's mouth down in Cork and Kerry from the people participating and working on the programme. And this video starts with our own lead, Aisling Sheehan, in relation to, she's leading on our alcohol programme. So I'll just play this video and it'll speak for itself.
So we know in Ireland that alcohol is a big issue. The latest research from the Health Research Board shows that 1 in 2 people drink harmfully, and it's estimated that 1 in 7 people in Ireland are dependent drinkers. So we're delighted under Sláintecare Healthy Communities that 2 new integrated alcohol services are being established. We also have a similar initiative in Galway City, funded separately, and our plan is over the next few years to roll out more services for people and their families so that there can be more support for people with alcohol issues.
The development will have a senior addiction counsellor employed. We will have 3 basic grade addiction counsellors, a project worker and a nursing post as well. Further to that, we'll have an alcohol liaison nurse within the acute hospital who was appointed earlier on this year, and the links then, as I said, between the acute hospitals and the community-based alcohol service will be really important.
Well, I work in the HSE Drugs and Alcohol Services, and I guess we see the worst impacts of it with severe dependency, and so I often see people who are in homeless as a result of alcohol dependence, and those who are repeat attenders at various services. And often, unfortunately, for primary care, there's a feeling of lack of empowerment, because they are seeing the same person back and again, and they feel that they have very little left to offer. And that's where I think the integrated alcohol services really come into their own, to give something that primary care can direct the patient to, and to integrate those various services.
So people can expect a high quality community-based alcohol service that's going to work with our local hospitals here in Cork City to develop and deliver integrated care pathways in order to support people in their local communities in as close to their homes as possible. In terms of ourselves in Cork and Kerry, this is a huge positive initiative to be under the Sláintecare banner, under Healthy Communities, and have additional resources to deliver and support on what is a significant issue in terms of alcohol harm. It's a very, very positive move for Cork and Kerry, and delighted to be part of this initiative.
A key component of Sláintecare is about delivering services in the community nearer to people's homes. Delivering high quality integrated community alcohol services is vital for individuals with concerns of alcohol, but also for their family and friends. We will work with colleagues in the acute hospitals, colleagues in primary care, in mental health, in health and wellbeing, in ensuring that we have a very integrated approach. I'm absolutely delighted that Cork and Kerry has been chosen as one of the first areas in the country to roll out this initiative in terms of integrated alcohol services, and I look forward to sharing the learnings that we ascertain from this project in order to help colleagues around the country in developing similar services.
So thanks again to our colleagues in Cork Kerry and our alcohol lead, Aisling Sheehan, for making that video highlighting that integrated alcohol services pilots are underway, and hopefully, as she said, that we'll be expanding on that. Can I invite now the panel to come up on stage, and I'll just introduce you to a couple of people that we've lined up here to have a discussion about what we've launched here today and yesterday. So we've Peter Brennan there, who's first on my screen in Bray Partnership. We've Anne Doherty, the CEO of Cork City Council. We've Ellen O'Dea, the head of service there, Health and Wellbeing in Dublin North, Dublin North Central and Dublin North West. We've Greg Stratton in the Health and Wellbeing Programme Manager in Healthy Ireland and the Department of Health, and we Fergal Landy, the CEO of the Family Resource Centre Forum. Welcome everybody, and I really appreciate your participation in this discussion panel today. So look at to date, or up to now on the webinar, we've tried to highlight the key components. We've tried to to give a bit of insight, but I suppose I'd like to know a bit more from the various sectors that you represent. We've talked a lot about inequalities at community level and how they impact on health and wellbeing. So maybe Peter, I can start with you. What's your experience of that?
Okay, thanks, Fergal. Yeah, so you've mentioned I work for Bray Area Partnership, and I'm here representing ILDN, the Irish Local Development Network. And so in the network, we have 49 companies spread in every county across the country. And our work is primarily, I suppose, working with individuals, families, groups, and communities who are experiencing, poverty and disadvantage. And I suppose, as Paul and other speakers have mentioned, in terms of the impact of health inequalities or inequalities generally on people's lives, it's probably not unusual just to note the fact that local development companies have been involved in health and wellbeing work for many years past. We see that, in terms of, let's say, for instance, our local employment service work. So people who are trying to make a journey to employment, obviously, poor health and well-being impacts on that journey. And so we need to try and offer supports that will enable them to move forward. And say, for instance, like just speaking from my own company, Bray Area Partnership. So when we are working with individuals through our local employment service, and we identify, or they identify to us, health or well-being issues that may be connected, to poor mental health, or maybe associated with addiction issues, we can link them in with our social prescribing service, or we can link them in with our local drugs and alcohol task force supported services. And I suppose in that way, using, I suppose, an integrated approach that, again, is a feature of local development company work, we feel we can provide for better outcomes for individuals in those circumstances.
Great, thanks a million, Peter. And absolutely, I take your point about the employability and being employed as a determinant of health in itself, and all the factors that influence it. Can I ask Ellen there? I know you've been involved in the interagency piece. You've been up to your eyes in it in recent years. Can you give us some insight on where you think this is going to push us in terms of the rollout of Healthy Ireland from a HSE point of view?
Yeah, I just following on from Peter there, I suppose we've had a really positive experience of working both with the statutory and community partners to both co-design services and deliver programs like Healthy Food Made Easy and the tobacco programs. And we found, I suppose, that from a health and wellbeing perspective, we want to work with people when they're well as much as possible to support them to keep well and prevent chronic disease. And our experience of working with the community sector is such as the community development organisations and the family resource centres, it's allowed us to bring the programmes of support to people at the right time in the right place. And Paul had talked about earlier about the importance of place in life course, and we would see that the community sector has been key in that delivery. Another key element of the programs delivered has been the peer-led programs, such as We Can Quit and the Healthy Food Made Easy, and service users are much more likely to engage with peers and feel supported by peers in changing behaviour. And the success of these programs to date is a testament to that, I think, is to the role of peers, and the only way we can access that is through our community partners. I suppose the other piece just to say is our statutory partners as well, such as the LCDCs, the SIPCs, Age Friendly, that's also been a huge enabler of allowing us to communicate with a much wider audience. And we've, I suppose, had a lot of success in collaboration on that side. And we're looking forward to developing closer relationships as part of these developments. With both our statutory and community partners, which will benefit everyone involved.
Okay, great. So you're trying to utilise the web of interagency groups that you have there for your area to address the web of causation, if you like, for what's going on or what in the key areas that we're targeting. Anne, can I come to you next there? From Cork City Council point of view and the local authority roles, you're going to be coordinating and working to try and address social determinants. It's no small ask. How do you see your role there taken off under Sláintecare Healthy Communities?
Great. Good afternoon, everybody. Thanks, Fergal. I think that what's really important from our perspective actually is the process is as important as anything. And maybe building on the two previous speakers, we have a very long and established history of interagency and intersectoral working in Cork City. We're the only local authority that maintained a rapid programme when there was no longer national rapid programmes. So I think that that's really, really important in terms of, because it's not about one agency. We all have to play our part, but it's actually what we do together is the most important, in my opinion. I think the process about how you get there in terms of involving people, our own processes have involved right across all the stakeholders, even in putting together our submission for the Sláintecare Healthy Communities funding. But I suppose what's really important to that is the knowledge base that we have in terms of right back to health action zones, and even listening to the social prescribing presentation. You know, it's very much grassroots about what communities believe they need, and how, rather than we arriving in telling communities what they need to get. So I think that's really, really important, and I think we need to be careful we don't lose that ground up piece. In the city, we're very lucky as well. We've been doing city profiles, so we've a very strong knowledge base of what are the issues and where those issues are. And so what we're trying to build then is programs that will be very much enhancing for communities, but also replicability, sorry, very strong word there at this hour of the day, in terms of the learning and being able to apply the learning across our city. I suppose finally for us, Fergal, you know, we have, I suppose, unusual things in place that help us. For the last 5 years, we've a joint appointment with the HSE working across both our community and social inclusion programs, and that's at a very senior leadership level, leveraging and matching resources. I think that the most frustrating thing for any community is seeing different agencies come in with their little pots of money. It's joining it together, it's leveraging it, and it's matching it. And to me, that's the opportunity that's coming out of this program.
Thanks, Anne. I was actually talking to Stephen Murphy and Sharon Parkinson about, you know, the role of Rebecca Lockery down there and how you're crossing over and really, you know, putting your money where your mouth is in relation to the partnership and the investment. So well done, and the best of luck as you build on that. Fergal Landy, can I come to you in relation to you know, the family resource centres? So you're playing a key role. It's a different role in different areas. So are you, how do you see it fitting into the remit of the Family Resource Centres, where you're sitting already in the heart of communities?
Sure. Absolutely. I think it sits really well with family resource centres. I mean, we've 20 of the family resource centres out of our 121 family resource centres are participating in social prescribing. I think more or less all of our family resource centres would be involved in parenting in one way or another. And then some are specifically involved in the parenting funded through this initiative. But, really FRCs located in individual communities meet and deliver a variety of social supports, and they deliver those across the life course, and they deliver those in a way that meets a variety of need, from the very universal and then to more progressively targeted. So I think that places family resource centres really well for participating in an initiative like this. It was great to hear Paul talk about place-based responses, and I suppose FRCs are based in places. They are very much physically and literally located in communities around the country. That makes them very accessible for those communities. We're also, through our community development approach, very participatory for those communities, with many members of those communities on the boards of individual FRCs. And it also allows onward connectivity into other supports through the Family Resource Centre. Other informal supports, but also we play a key role inside the connectivity between the informal and the formal. So by working through interagency fora and working collaboratively, we can play that both ways, sometimes be the connection between the formal and the informal, and connecting upwards from the informal to the formal. And also we work, locally, but also regionally and nationally. So those 121 FRCs meet regionally and ultimately provide representatives onto the National Forum of Family Resource Centres, where I work. So we mirror in some ways the local to the national, and the national back down to the local in the way that we work. And at the National Forum level, the involvement of our mental health promotion project really helped as well with our involvement in social prescribing, because it gave us that ability to reach
I had some insight into
down to the local. Yeah,
I had some insight into the National Mental Health Promotion Project that you're involved in there, that when it was sponsored by the HSE National Office for Suicide Prevention in partnership with TUSLA. So it's great that that work has been embedded as a standard approach to mental well-being and suicide prevention across your units, I guess.
Absolutely, and we see that and the way that has grown and developed, and our involvement in social prescribing as an opportunity really to be local, but also to be connected into national policy implementation. So it's not a binary thing of being fully local or top down or bottom up. It's about actually being the connection between the two. And I think that's worked very well in the Mental Health Promotion Project. It's working very well in social prescribing. And I think it has the potential to work very well in parenting as well. So we're very keen to be involved, I suppose, and maybe to grow the involvement, because as you mentioned, not all FRCs are involved in every aspect of it, and they may not need to be, but certainly where they need to be or where their community needs them to be, it's about trying to grow and build the capacity to be even more involved.
Thank you very much. Greg, if I come to you now, there was a good few questions in the chat there. I know a lot of them on the Q&A, a lot of them been answered. People asking questions about these new posts, and a lot of interest in the new resources, where they're landing, how they're landing. But the question I have for you is, this isn't the first time Healthy Ireland has engaged in multi-agency work. So how is Sláintecare Healthy Communities building on the platform that you've been investing in over recent years?
Thanks very much, Feighan. I think we've been investing into the local community development committees via the Healthy Ireland Fund since 2017, and we've really seen the value of that investment, and the value of the partnerships that we've been able to mobilise within all of those local authority areas. The Healthy Communities doesn't replace that. It very much works in tandem with it, and enhances that work that we've been doing. We see this as something that works collaboratively with these existing activities. Additionally, also when we look at the research, we can see that the evidence around health inequality suggests that we need to provide specific and targeted activities at local level to address health inequality. So very much we're looking, we're leveraging that existing investment and those existing partnerships that are already established.
So just a question, I'll leave it open to the panel there, and anybody can jump in on it. Like, what do you see as the big kind of challenge or opportunity for you at the moment, setting out, like, we hope that all these Sláintecare Healthy Communities initiatives will be hitting the ground in a real way in the coming months. So challenge and opportunity, what's, like, just a few words from anybody else before we close this out?
Yeah, Fergal, maybe sorry not to cut in. Yeah, I think other speakers have sort of mentioned, I mean, clearly the programme has national objectives, but I think our challenge, certainly through ILDN, is to try and sort of realise those as, real and tangible local outcomes. And I think people have mentioned, the importance of, the local communities or population groups that we want to try and target in this programme. How important it is to ensure that that they're front and centre in what we're doing, if we want to make stuff real. So I think that's both a challenge and an opportunity, to be honest.
Absolutely. Anybody else want to get in on that?
Yeah, hi Fergal. I would agree there with Peter in terms of, and people have mentioned it on some of the chat there, is particularly particular communities that are further risk of exclusion within communities, and how we make sure that we're really that everyone within the community can access and is aware of, and that we're doing our best both in terms of engaging with key stakeholders that represent those groups, but also I suppose really focusing on that kind of health literacy of making sure we're getting out information in really accessible ways through different types of communication to make sure that everyone knows that these activities are there and available to them, and that is a key challenge, but it's also an opportunity, I suppose, to engage people.
Okay.
Sorry, Greg, I don't mind.
Please go ahead.
Thank you. I suppose, Fergal, I would just one thing I think that we need to, with national programs, and it's great to have a national program, but we're not homogeneous. Like, it is a very heterogeneous world we live in. Everybody is at a different state of development, and so therefore, there has to be some local flexibility and some local the local knowledge is really, really important, and different areas will rise at different paces, but that's okay. But I think that we need to really, really accept that this is not homogeneous and be very respectful of the heterogeneous nature of what we're trying to do. Okay,
thanks, Anne. Is that okay for everybody? Is there anybody else wants to burst in with another addition, or we'll leave it there?
I just wanted to just underline the opportunity that we have across government, and the fact that this program links to a cross government group, and that the learnings from all the various areas will be used to inform policy, and that that local implementation will feed up through the various structures that we've set up around it as well. And I think that's a real opportunity going forward.
Okay, that's a nice way to end that panel, and thank you very much everybody for participating in that, and it's great to get your insights from the various sectors that are going to have a key role in implementing Sláintecare Healthy Communities. So thank you to everybody for that. So I think that's nearly it. Now we're just going to come to the closing remarks, but before I introduce the closing remarks from our HSE National Director, Dr. Philip Crowley, I'd just like to thank everybody for tuning in today and for your time, attendance, and participation in the Q&A. I know so many people are so engaged around this, and obviously, this is day one or day two since the press launch was yesterday. So there's going to be a lot more communication needed around this program, and we look forward to working with the various sectors to support your local engagement and delivery. So I'd like to hand over now to our National Director, Dr. Philip Crowley, who's been a huge advocate for our health inequality work, and he's going to give you the closing remarks today. Thank you.
Hi there. My name is Dr. Philip Crowley. I'm the National Director of the Strategy and Research Directorate in the HSE. And I have responsibility for the Health and Wellbeing Division, which has been so pivotal in developing the work that we're launching today, the Sláintecare Healthy Communities programme. I'd really like to thank our ministers, Stephen Donnelly and Frank Feighan, for their support for this programme. A very significant step forward, I believe, in really creating the kind of partnerships that will impact on the determinants of health and really get serious about health promotion and preventing ill health. In our health service, we've a very significant focus on treatment and in some ways on kind of patching people up when the harm is done. And really, we see this as a big step forward in really upping our game in relation to health and well-being promotion and improving people's health and hopefully reducing people's need to use our health services. It also represents, I think, a key element of partnership working that I think we won't really achieve much at all if we don't work together. I mean partnerships with service users, and service user partnership is very key to me. There's 2 service users on my management team, but also partnership with the communities where they live. Communities that often are seen in terms of deficits, but communities that have tremendous assets and things that we can build on, people that we can work with, activists, people with knowledge of the local community. And when we work together, and then in particularly with local authorities, we can really start to change the conditions and make healthy choices the easy choice, because I'm very aware that healthy choices are not always the easy choice. And we need to work together to try to make sure that they are. So we'll be undertaking over the next number of years an expanding program of work to really embed in communities access to healthy choices around healthy eating, exercise, smoking, and alcohol use. And really working, as I say, with the communities in a whole new way. I think today is a kind of a red letter day in that we're launching this program. We will watch it unfold over the next number of years and watch it expand right the way across many communities across Ireland. I'd really like to thank our speakers today who've contributed to this very successful launch of the Sláintecare Healthy Communities programme. And really, most importantly of all, the engine that's going to drive this programme, the community healthcare organisations, health and wellbeing teams, Angela Alder at the helm, and our own health and wellbeing team in strategy and research with Helen Deely, Aisling Sheehan, Sarah O'Brien, Martina Blake and Fergal Fox and their colleagues. An enormous amount of work has gone into this programme so far to create an evidence-based programme that's going to have a real impact and we're going to build on this, and I look forward to engaging with it as it develops. And I wish everybody the very best for today, and thank you all very much for participating. Thank you very much indeed.